The fact is, we are all affected and we're all in this together, and that includes me. Like most of you, my own family has had multiple close contacts with COVID. Like so many of you, I have been rapid testing and monitoring for symptoms. Several days ago, I came down with a cold, what seemed to be cold symptoms in any way. Wednesday morning, I did the test and it came back positive, and I'll now be getting a PCR test. My family and I are now isolating, and we're all doing well. I have a bit of a cough, I have a sore throat, some head congestion, and the symptoms are very much like having a cold. But having said all this, I'm thinking how fortunate that we are and how blessed we are in this province to have access to vaccines. You know, I've been able to continue working and attending meetings virtually, and when time permits, you know, it's an opportunity to maybe sit back for a moment, because after all, this is supposed to be a break period. But it seems in New Brunswick, break periods aren't like they used to be. I know we each have had our own experiences, so I can only speak to mine, but I can tell you this. I am double vaccinated, plus I've had my booster. And because of that, I'm confident that my symptoms will remain mild. In addition, my family, my wife, Marcia, has been double and triple and boosted as well as my family members.
The Omicron variant of the COVID-19 virus cannot be stopped. However, we can and must take action to slow the spread. As we have done throughout this pandemic, we must all adjust our thinking and our strategies to address this new reality. Every region of Canada is now reporting record levels of COVID-19 infections. In Ontario and Quebec, the numbers have exceeded 10,000 new cases a day. New Brunswick is experiencing its own dramatic rise in infections. At the current rate of growth, we could see as many as 1,000 new cases every day within a week. While our hospitalization numbers remain relatively low, that is likely to change in the days ahead. Omicron, particularly among vaccinated people, and especially those with a booster, does not appear to have the same severity as the Delta variant. The hospitalization rate for Omicron is less than 1 in 100 cases, compared to almost 6 with Delta. That doesn't sound like much of a problem until you factor in how quickly Omicron spreads. The sheer volume of cases is the concern. If we hit a rate of 1,000 cases a day, we could see more than 160 COVID-19 patients in hospitals across New Brunswick by mid-January. That would very quickly overwhelm our healthcare providers.